That's not a bandage. What is that? What do you think that is? Do you think I'm supposed to be not taking this off?
Listen, I don't know.
What is this? What is this?
It's a square. It's like a perfect. It's a perfect square that's been pulled.
Well, I'm here for the surgery. I got scrubs on and everything, and they're trying to get me ready for it. So, kind of nervous, but hopefully it goes alright.
My head kind of feels like numb and a little bit of pain. I feel like groggy. But I guess it went okay. I can move my face, so that's good. Yeah. I don't know if you want to like pan around and see what I look like. Right there.
So I want to touch on some things that happened the day of surgery that I didn't really talk about yet. To backtrack a little bit, they call you the day before surgery to tell you what time to come in, and they told me I was supposed to be at the hospital by 5:30 in the morning, and I wasn't super excited to hear this because it was a 30-minute drive or so for me, so I had to get really early. And then you have to stop eating anything before midnight the night before surgery, and then they say you can drink clear liquids up to an hour before you leave for the hospital. So I had like some water and black coffee at 4:30 in the morning, and then I had to stop drinking any fluids. And then we drove there, and we got checked in, and then they escorted me back, and they did some tests, and then the anesthesiologist came to talk to me, and I had to sign some forms, consent forms. They also talked to me about nausea or dizziness side effect, and they told me I could have a patch behind my ear, or there was this pill they could give me. So my mom's had some previous experience of getting nauseous after using anesthesia, so they said I might have that as well, so I took the medication. They also told me that I'd take some Tylenol before the surgery. So I did have a little bit of water when I was taking those pills, but I guess it wasn't enough to like cause any problems during the surgery. Then I also saw the surgeon again, and I had to sign a form, and then he used like a Sharpie marker, and he marked the ear that he's gonna be operating on. And I was glad that I was awake and coherent while he was doing that. I was kind of had this underlying fear that they were gonna operate on the incorrect side, so I was glad they took these extra steps to like reassure me that they had everything correct. And then they would have me do safety checks, like repeat why I'm there, what's my name, what's my birthday, what type of surgery am I having on my left side. So it was just confirmation that I was the correct person, I'm having this type of surgery, so that they don't accidentally make a mistake or something and do it on the wrong type of person. So that was that.
I decided, they said they could have gave me like some like relaxing medication, but I said not to do that because I wanted to be like coherent all the way up to the surgery, and that was actually kind of fun because like I got to be awake when they wheeled me in, and I got to see them like set me up with all the equipment, and then they just put like a breathing tube on my face that's probably what actually put me to sleep, but I'm kind of glad I was like awake for that.
I said it a little bit earlier, I didn't take the relaxing medication, so I was coherent when they wheeled me down to the surgical room. And I had one of those, like, I was on a bed, and they wheeled me down the hallway, and then they took me to the surgery room, and they put, like, the wheelie bed right next to the surgical bed, and I had to, like, scoot over onto the surgical bed. And then they started, well, they asked me again why I'm there, what type of surgery I'm having, and then they had me like get hooked up to a bunch of equipment. A lady came over and told me, she said, once you're asleep, I'm gonna put these like sticky pads on your face for the nerve monitoring. So when I woke up, I could feel like some sticky stuff on my face. They also told me when I fell once I fell asleep, they were gonna put the breathing, like a tube down my throat so that I could breathe during surgery. But I wasn't awake when that happened. But then they put a mask on my face, and it was just oxygen at first, but then I think they started administering the anesthesia through the mask. And all I could remember is my ears started like ringing, and then I started feeling like pressure in my head, and I was trying to tell the people around me, I was like, this is what I'm feeling, and then I just blacked out after that. So I guess that's what anesthesia is like. You just go on completely. And then when I woke up, I felt really groggy.
My head kind of feels like numb.
At first, I could hear like noises, and I was trying to like come back into it, and then like right away, I mean, it was like I have to use the restroom so badly. So I don't know if they pumped me full of fluids, is what it felt like. So it was uncomfortable when I woke up. So they helped me with that. Then I started asking the nurse a bunch of questions. It's like, were you able to fully insert the electrode? How'd the surgery go? And she's like, well, I wasn't there for the surgery. I don't know. I'm gonna go get your mom, since she talked to the surgeon, so she can answer your questions. So then my mom came back, and then she told me that they were able to fully insert the electrode.
Said the surgery went pretty well, and they were able to fully insert the electrode, which is something that I was like worried about because the Medel brand's like longer, and I was afraid it would like get stuck. So I'm really happy about that.
And that I had an extra bone in my ear that made the surgery take like 4.5 hours when it should have been like 3-hour long surgery. That was kind of a surprise for everyone. I didn't know that. I think my grandpa has like an extra bone in his ear too, so it might just be like some hereditary thing that I wasn't aware of. So it's kind of interesting. I'm glad that they were able to still proceed the surgery even though this complication was there. Well, they took the IV out, and I got dressed after that point, and then they got me in a wheelchair, and they were wheeling me down to like the main entrance, and I was supposed to pick up some medication, like pain medication. So that was right by the main door, and my mom was like, I'm gonna go get the car and you can get the medication. So we split up, and the nurse was still there with me. So when I tried to get the medication, I told him like my name and birth date, and then she said, you have to pay 14 cents for this medication. And I was like, I have absolutely no money on me right now. I don't have my wallet. My mom has my wallet. And I was like, what am I supposed to do? And I was like, well, we can wait till my mom gets back, because I was trying to tell her. But then the nurse, she was so nice. She's like, I'm going to pay your 14 cents for you. So I thanked her, and she was really sweet. And then I got the painkiller medication, and then they wheeled me out to my car, and I got in, and recovery from there. Hi, so they discharged me, and I'm driving home. I'm not feeling terribly dizzy. I took some meclizine to try to like help with that a little bit. My left side kind of feels like it's like throbbing a little bit. And it kind of feels like numb, but that might just be because like pain medication, and I have to take like extra meds later. But I feel okay at the moment. They put like stickers on my bandage, it's kind of funny. I'm just so happy that my face is not paralyzed right now. I don't know why, but I was like so scared about that, and it's just such a relief, and I hope it gets all better from here. So my tongue kind of feels a little bit numb, only on like the left side where the surgery was done. And my mom tells me, because she talked to the surgeon, that the nerve might have just been a little bit irritated during surgery, so that's why I'm feeling this. But he said it will go away in a couple of days, and it's not something that I need to be worried about. So that's the only nerve side effect that I've had so far. So I'm home from the surgery now, and I was feeling fine in the car ride, but then I came home and I was trying to sit at our kitchen table and eat some lunch, some soup and toast, but then I started feeling nauseous a little bit. I was a little dizzy, and I had some sweats, so I tried to damp myself with a wet washcloth that kind of cooled myself down, and then I found a recliner, so I just tried to stabilize myself, and now I feel a lot better. And they did warn me that this might happen, that I might feel a little bit dizzy or have balance, but that it'll get better. So my plan is just kind of camp out here for the time being. It's another thing, they put the IV in my arm, or my close to my wrist. So when I came home, my wrist was kind of hurting a little bit. It seems to be getting better, but I think that was just from the IV being in there for such a long time. And then, because they put the tube down my throat's been kind of scratchy off and on, and then I was spitting up a little bit of blood when I was trying to brush my teeth. So I think it'll get better. It just needs to heal. I wasn't used to having something down my throat. Another thing I wanted to talk about was clothing you wear before you go into surgery. And I talked to 2 other people that already had cochlear implants, and the one lady recommended wearing a button-down shirt so that you don't wear a t-shirt that you have to try to pull over your head. It's easier if you wear something buttoned down, so you can just pull it over and button it down. And then she also said it's easier if you wear slip-on shoes, so you don't have to be bending over and tying your shoes. It's just slip it on and go. So that worked out really well for me, and if anybody who's watching this has this surgery, I would recommend that as well. So in terms of tinnitus after the surgery, it's about the same as I've always had. I've always had tinnitus, and it was ringing, but it's not like it got worse after the surgery, so it feels about the same. And I'm hoping maybe after the implant's activated, my tinnitus might get better because I can hear better, and then the brain will have a better perception of sound. So I'm relieved that I don't have screaming loud tinnitus right now, and that's what I'm feeling. Hi. So, Travis is here. He came to see me, and he got me flowers. And they're beautiful. It's so pretty. He got me this orange one that's a rose. I really like orange. He picked it out for me. It's so sweet. So, he's made my recovery fun. We've been talking about everything that happened, and I'm glad he's here. Say something.
Love you.
Love you too. Wait, don't start it.
Why not?
I don't know how to take it off.
Well, this is part of the process, so I think it's very important that we do, in fact, film you try. Do you want to take your hearing aid off?
Oh, here it is.
Wait, hearing aid. You're gonna knock it out.
Huh? What?
You want to take your hearing aid out before you rip that bandage off?
I guess so. Oh, it's it's sticking to my hair.
Yeah, I bet it would.
Ow.
Oh yeah, it is.
Oh, you did such a bad job putting this on.
Looks like you're kind of on the home sleep.
Huh?
There's no more hair stuck to it. Lift your hair up.
Oh, it's stuck here. Ow! What's stuck right here? Something's stuck. Ow! My hair's stuck. this? I think right here's just like caught in the stickers.
Oh yeah. I want to help, but I'd really hate to ruin the shot.
Ow. Yeah, my hair is like, it's like they put my hair under the stickers. Ow. Right here, there's like, don't you dare yank it right now. It's like every hair is like caught in this thing. Ow. Sorry, Darren. What is it?
Do you have a bandage?
It's easier as I thought it was gonna be. What? It feels like there's something still there.
Yep, you're correct.
Yeah. What is it?
Just like another bandage. It's cut around here. Maybe
Yeah.
you should keep that on, actually. I don't know.
No, I thought I was supposed to let it air out.
Oh, okay, and then rip that thing off.
I don't know what it is. I need to look at it.
Okay.
I just don't. I can't tell what it is. I don't start like ripping stuff that I can't see. Oh. What is? Maybe that's not a bandage. What is that? What do you think that is?
What do you mean? It's just more bandage. They cut around your ear though. That one.
I'm just kind of scared to touch it.
Does it hurt, or are you scared about it?
I'm scared. Also feels sticky. Do you think I'm supposed to be not taking this off?
Listen, I don't know.
What is this? What is this?
It's a square. It's like a perfect. It's a perfect square that's been pulled off.
Ugh. That was not fun to watch.
It was pretty entertaining.
All my hair on the side of the head is like matted together and like stuck with like sticky glue. It probably is. It's probably from the bandage.
That is quite accurate.
Yeah. I don't really want to feel like trying to move it. That's probably why the bandage hurts so much, because I had like hair stuck to this
Yep.
bandage.
Indeed.
And ow.
I don't know. It feels a little unresponsible.
What do you mean?
Well, there is in fact hair stuck to the side of your head.
Are you
the
still
bandage.
numb?
This feels weird. It feels very vulnerable right now. Like I can, kind of feels numb and.
What, do they have to cut your hair or something?
They
They
did.
shaved a part around the ear, but I can't really tell. It actually looks like there's still hair there.
A little bit.
So
if you
that-
put your hair down.
Yeah, you would not know.
Can you see it? I don't know if I should. Do you even see a scar?
I can't actually. Well, actually, under your ear,
Yeah.
where it won't focus. A little bit of blood, but.
I feel like I should. I don't know what I should do. Try
Do
to
they
move
give
the
you,
hair on this area.
instructions?
Wait. There's something else up here.
Did they do that? Did they cut up there?
Wait, no. There's like more. Or that is that my hair? Or is
No, move your head.
I think there's more bandages. Maybe it's just my hair that's feeling really weird.
Really don't want to hurt you, but
Is there more?
I can't tell.
Oh, I need to look in the mirror.
Okay.
It feels like I have something right here. Or maybe it's just my hair, like, it feels like I have hairspray in my hair, and you know when your hair gets, like, rock hard.
I've never used hairspray in my life.
Well, my mom uses it, so I've tried it, and I don't like it that much, but dang,
Oh,
it feels
you should use
just
some
like that.
hairspray.
Whoever's used hairspray too much, like used way too much hairspray, knows what this feels like. That's what this feels like. Like, it's crunchy, and it's hard. Like, right here. I thought this was a bandage, but I think this is just my hair being really crunchy. Ooh.
And you just look like you took a long nap.
I know.
everyone. So it's been like a week after the surgery, and all the footage you just saw was mostly right after the surgery. So I've just been like working on editing it. But I'm gonna make another video later just talking about more about recovery and the whole process. So be excited for that. And there's gonna be more about like the activation day, because they won't turn the processor on for me until a month after the surgery, so that's another exciting point. And then it'll just be about my journey of getting better and adjusting to the technology, so I want to share that with everyone. So make sure to like and subscribe if you want to see that. I feel really weird saying that. Please do join if you want to follow my journey with you. So thank you for watching.